Hello, everyone, and welcome to Mentoring Youths at Risk Master Clinic, organized by Mentoring SG. As you can see, it's greatly endorsed and supported by all these entities, all in the name of youth, because we believe in youth. Here are the masterclass or master clinic speakers. We'll start off with speaker number 1, 𝗪𝗟𝗡. He's the Executive Director of Youth Guidance Outreach Services. Dr. John Tan, Executive Director of Children at Risk Empowerment Singapore. And of course, myself as a third speaker, I'm the founding chair and director of Architects of Life. Let me do some preliminary opening remarks first, because we're talking about youth at risk. Who is a youth at risk, or YAR for short? Who is a youth at risk? What and how do we define a youth at risk? So if you just take a look at media and the articles that have come out over the past year or past 6 months, you'll see a lot of news, right, revolving around young people today. Not all of it is positive, and I thought I would share a couple of articles here. This was just a few weeks ago, Chinese New Year. We have also been working with the CNB and Ministry of Home Affairs, and a report has surfaced this more drug abusers under 20 years old net in 2024, and the youngest was 13. Those of you who are concerned individuals, you have read the articles regarding this 13-year-old and 14-year-old kids who were abusing and trafficking in drugs. Then you've got just a couple of months ago, where this was a very troubling report: depression, anxiety, stress. 1 in 3 Singapore youth reported very poor mental health. And this was, of course, an IMH survey. 1 in 3 young people in Singapore with severe or very poor mental health. Are they at risk? You bet. And then, of course, suicide rates. While generally speaking, as a nation, suicide has gone down in terms of the stats, but youth suicide is on the rise still. So suicide is a problem among youths in Singapore. Let's talk about it. All these kind of, signals the real need to reach out to young people today, this generation, right? So when we talk about youth at risk, let's get back to some either terminology and defined terms, especially for us as a common statement in Singapore. I will show us right now on this screen the definition as stipulated by MSF, Ministry of Social and Family Development. So youth at risk in Singapore is defined as age 12 to 21 years old, who are predisposed to delinquency, substance abuse, antisocial behaviors. The keyword predisposed. And what are the causes? Well, due to a combination of biological, psychological, social factors, family issues, academic struggles, environmental challenges. This is a very generic definition for Singapore when we talk about youth at risk, age 12 to 21, and predisposed. In other words, no offense has taken yet. They're not offenders, not yet at least, but they are predisposed and they are at risk due to all these factors. Tonight, we want to talk about this group, this profile, but with a slight slant that mentoring, because we're all believers of mentoring in Mentoring SG, why mentoring can help them. And mentoring being a very relational term, can reach out to them, build a bridge of relationship of trust, and thereby engaging them at a different level. So the three of us will be talking about this. We're going to start with 𝗪𝗟𝗡. All three of us represent our agencies, and we're going to share best practices, what we have been doing over the years. I'm going to introduce our first speaker, Mr. 𝗪𝗟𝗡. He's the Executive Director of Youth Guidance Outreach Services. He's also a council member of Youth Work Association Singapore. He's got many years behind his in his portfolio working with at-risk youth. Maybe later on he'll share also how his organization has actually run various successful mentoring programs, reaching out to community youth, as well as government-sanctioned youth, those in drugs or those with behavioral offenses. So at this point in time, please help me welcome Mr. 𝗪𝗟𝗡. Wilson, over to you.
Good evening, everyone. So as I get ready to share my slides, it's been a privilege for me personally to be in this journey of working with young people, supporting young people, mentoring young people all these years. In YGOS particularly, we really believe in mentoring. And this evening, I would like to just briefly share with you one of our approach and some of our key programs, especially in mentoring young people, both in the community and also in the schools. From a systemic point of view, if you look at a young person, in many ways, we do not look at them as an isolation individual, right? We look at them as a systemic views. So having to look at the different systemic influence in their life, particularly family, schools, the community, and also among their peers, has great influence in the life of the individual. You and I plays a very key role in supporting young people and in mentoring young people at the community level. Some of you who are in this webinar are very much educated working in the school context. You have an important role in also educating and also mentoring and also journeying with a young person. Some of us are parents ourselves. It is also crucial and important for us to create a joyful, peaceful kind of environment at home so that our young person, our children can thrive during this growing up developmental stages. Allow me to just share with you our experiential learning and mentoring program. It is a community-based mentoring program that serves young people aged 10 to 19 years old, that revolves and stays in the community, right? Both in latchkey kids, particularly the kids who are loitering, spending a lot of time in the neighborhood. These are the young people that we target, and these are young people that we focus on engaging them through mentoring so that they are supported and not be influenced by the negative peer at the community level. A lot of the referrals comes from schools, parents, government agencies, and also fellow social service agency. So we take in referrals cases, and if you are interested, and if you have any young person who are in need, who have somebody who can journey with them, please write in to us as well. Well, the objective mainly is to really build a supportive relationship and for the young person to be journeying with an adult who will care, who will support, who will give them the necessary guidance in their developmental stages. Young people, as they go through their journey as a young person, they experience lots of challenging difficulty, right? And we want to make sure that they are able to learn from all these experiences by having a mentor who can then journey with them, who can debrief with them, who can give them certain guidance in understanding how they can navigate through the various challenges in their life. We also seek to create meaningful opportunity so that they have a sense of belonging. They have a sense of a group of people who can give them the necessary care and concern, who can give them the attention, who can support them, and last of all, who can also provide safety, that they feel safe, they feel open enough for them to share their concerns. These are some of the tools that we use for our program. Some of you may be very familiar with some of the, especially the ACT-SG, where we focus on helping a young person to achieve, to connect, and also to thrive, right? And of course, we also do Hit Screen 10, and lastly, the Mentor Youth Alliance skill. Usually we'll do this at the start of the program, and we also will conduct it at the end of the program. So we compare both sets of questionnaire, and we will be able to have a better understanding of how it has benefited the young people as they go through the mentoring journey. This is our school-based program that we have conducted in many schools currently. Mentoring Alliance program is a school-based mentoring to help and serve students between the age of 13 to 19, primarily providing school social work intervention for at-risk pupils. So we do early assessment, early identification, and also early intervention for at-risk pupils. So we hope to be able to connect them with community adults, mentors who are between 21 years old all the way to 70 years old, who can then journey with them over a duration of 6 to 12 months. This program is primarily conducted in the school, but the mentors are mainly professionals and communities who will provide the support to a young person in the school context. As mentioned earlier by Glenn, the definition for youth at risk is between 12 to 21 who are predisposed, right? These are young people who are vulnerable and in experiencing adverse outcome as a result of engaging in risky behavior, right? Due to certain risk factor in their lives. So I'm sure you can identify some of those risk factors over here at the slide. Some of the young people that we come across may have encountered and may have experienced or may have predisposed to some of these risk factors, right? Of course, there will be some who are in trouble with the law, right? So we will call them the juvenile delinquent, right? So it basically defines them as young person who commits criminal act between the years of 10 to 16, right? The focus is really to help them in the rehab process, right? And to help them reintegrate into the society and to prevent reoffending for these young people, right? One of the important programs that YGOS is currently doing is the diversionary program. We basically hope to divert some of the young people who are first-time offenders through counseling, through intervention, through family intervention. We hope to be able to direct them away from the justice system. After they have completed the program, we hope to be able to continue the relationship through mentoring in the aftercare phase, so that the young person are being supported beyond the program that they have gone through. Just some information for our understanding in the youth offending situation. This is the statistics from 2016 to 2020, the top 3 youth offending behavior. It has always been short theft all these years, but in the last couple of years, we have seen an increase in cheating and related offenses. Example, scam. And lastly, the sexual penetration. A lot of attention has been given to young people who have committed sexual offenses, and we are indeed concerned for the rising numbers of young people caught for committing such offenses. So it is our duty, it is our concern among the young people who are exposed to criminal behavior, risky behavior that potentially gets them into trouble. Other youth offenses that are of concern is vaping and electronic vaporizer. This has been on the rise in the last 4 years, and the number of young people that were caught for such offenses also risen over the last few years. So we are indeed concerned. A lot of this vaping liquid or chemicals are also tainted with drugs, right? So it is definitely of major concern among young people who can freely get hold of a vaping device just online, right? They can purchase an item that is delivered to their home quite easily. So as adults, as mentors, we want to make sure that we understand what are the young people and what are they going through, so that we can then provide the necessary support. In YGOS, we do help young people who have experienced adverse childhood experiences, right? These are young people who are potentially traumatized by events or activities that happen in their childhood phase, right? It has long-term effect on the young person's well-being, right? And we are concerned on how the young person is coping, so that the past need not affect their current risky behavior. So we are definitely interested to how this can, how we can support the young person through identifying some of this trauma, some of these adverse childhood experiences that they have gone through. And I'm sure you, in your interaction with young people, you may have heard, you may have interacted of young people who have gone through some of this traumatic experience or even events in their life. It has correlation between ACE, adverse childhood experiences, to their current behavior, right? Because statistically, research tells us and informs us that a young person who goes through multiple ACE have a more increased aggression and violent behavior. They are more likely to have school problems, and they are more likely also to mix with negative peer influence. It will affect their developmental processes, and worse still, it can also affect their mental and physical health. And many of them, because of all this adjustment and all these challenges and difficulty, they are more likely to be involved in the juvenile justice system. So how do we counter the ACEs, right? Let me introduce to you the positive childhood experiences, right? These are events and relationships that makes a child feel nurtured, valued, and supported, right? And there are 7 positive childhood experiences that can be linked to good emotional and mental health being, right? And many of you are parents here today, right? How do we create an environment where we can nurture them, where we can make them feel that they are valued? And as mentor or educator or even counselors, right? How can we play that role of giving the young person at least 2 non-parent adults who are interested in their life? As mentor, we do journey with them and support them and giving them the necessary influence that is positive so that we can counter the ACEs that some of the young people that have gone through. When a young person who have encountered positive relationship, it can buffer adversity. They will feel more positive, they will have more confidence, and they will have less and fewer issues in mental health. They are well supported emotionally, and they are supported both in a family and also in a community because they have the resources and they will definitely be able to feel that confident and resilient. So mentoring youth at risk is an important key to helping young person whom we coin them or we term them as at risk or juvenile delinquent, because they can be constructively be engaged by that mentor who can then help them deal with the undesirable activities or risky behavior that they are exposed to. A mentor can provide the support and be that positive role model in their lives, who show genuine interest in journeying with them, who believes in them, who give them the confidence that they have the resources and the resilience to overcome some of the challenges. And lastly, I think mentor plays a very key role in helping them to explore their interests or even career options, and then setting them to the path of achieving those goals that they have set for themselves. Young people or youth matters, right? We all can make a difference in the lives of the young people that we are mentoring or we are journeying with. And therefore, if all of us put in our resources, if all of us identify who are the youth at risk in our community, and that we are able to give them that support, we all can actually make a huge difference in the lives of many young people. Thank you very much.
Thank you, Wilson. Thank you for your insights. Okay, at this point of time, I want to introduce to you speaker number 2. He's none other than Dr. John Tan. Now, he and a few others like Wilson and many other SSA, social services and agency heads, we are all like counterparts. We've seen each other grow and do great work over the decades. Dr. John Tan is one of those. I've known him for more than 30 years. He's the executive director of CARES Singapore, Children at Risk Empowerment. He's also the founding president of YGOS, Youth Work Association Singapore. He was appointed the head of Asian Center for Evidence-Based Mentoring, or ACBM, and he's on our management committee as a member of Mentoring Alliance SG. So he's got many other accolades, but we don't have time. I shall pass the time right now to him. John, over to you.
Thank you very much, Glenn. Yeah, let me start by sharing my slides. I have a very ambitious title indeed today: Mentoring and Mental Well-Being as a Therapeutic Journey. So firstly, some disclosure. I deem myself as a youth worker for many years. I've been leading an agency as well, but my heartbeat is always working with young people, and particularly young people who may need additional support. And lately, in the last 10 years or so, it has been also journeying with people with mental health or mental wellness challenges. Now, another disclosure, I've used AI to create this, image. And this image, there is an older person guiding a younger person through a winding path. It is sunshine, it is clouds, it's raining and all that. It's just describing a journey, as you heard Wilson mention earlier, the word journey many times. And yeah, I'm using this also as a metaphor. Maybe firstly, some, what I would say, personal caveats, okay? So I'm using a very big term. It is a technical term in some areas called therapeutic mentoring, but my personal caveats. Firstly, I borrowed the term, or in Singapore or Singlish, we just copy it first. Why? Because I found it something useful to use here and to adapt it to a personal use. And today, my sharing is from a personal experience. It's not yet a program or a service per se. Okay, so just bear with me. I don't have many slides, but it's just to describe my journey thus far, all right, in this particular topic. Let me maybe go by the definition then of how I would define therapeutic mentoring. Well, it is intentional, sustained, high quality, and skill building relational journey of a mentor and a youth seeking mental well-being. Okay, so it's a very long definition, but to me, it's a working definition. All right, and a few key factors that I will attach to it. Firstly, is strengths-based. All the practitioners here, I believe, would approach engaging or interacting or helping a youth using a strengths base. That means we believe in the strengths of a young person. It might be hidden, but it has yet to be extracted. So it just needs that additional care and extra care to be extracted, all right? It's intentional. So everything that we try and do has an outcome that we want to see happen, right? So it's intentional, it's sustained, okay? And if you are working towards journeying with a young person with need of this kind of support, it has to be sustained over some time. I don't know how long. Sometimes it takes a long time, right? In my particular journey, it's quite a long time. It's high quality as in it demands a lot from you. It demands a lot of attention, focus, as well as skill. And it's also about skills building, okay? So I'm describing here a journey that I have taken or am taking still with a mentee who has been diagnosed with borderline personality disorder and who has attempted suicide before. And this journey is towards some form of functional normalcy, right? So big term, but simply saying that just to live life, maybe survive, but not yet thrive, and hopefully one day will thrive. Yeah, so it's a personal sharing, okay? So this is what I have learned along the way. If an adult wants to come alongside a young person with, challenges, then you must be prepared for a path of up and down. Sometimes more downs than up, right? So it's a journey winding, but it is up and down. And so that sustained effort has to be there all the time. So there's a lot of commitment on the part of a mentor who come alongside and journey with this. Trust is key. Trust means give and take. Actually, sometimes it's more you give and then you take, right? And it's about, showing patience, having that patience while at the same time persevering. Sometimes the path gets so convoluted sometimes and you don't know where you are going also at times. And it requires perseverance. So I have discovered that by me being real, sometimes the patience does get at you when you are journeying with a mentee. Maybe they might be trying, or maybe they just have difficult days. And when those days come, what do you do? Okay. So this particular journey I've taken with this young person is now, I think now it's reaching to the point of about maybe, it's actually over a period of a long time, but in the last 4 years, maybe towards a journey of functional normalcy, when this mentee can then begin to practice some of the skills that we've been talking about. And that requires patience and perseverance. It also requires a certain amount of accountability. So it's not something whereby we just let the mentee decide and move about. It is where there's flexibility, but there's also the term called supportive accountability. Supportive accountability, by the way, there's a course that is conducted in the university in Boston that focuses on therapeutic mentoring. And one of the key things that they have put forth is the concept called supportive accountability, meaning that you hold your mentee accountable for certain outcomes or goals that they want to achieve. Yeah, so there is a target. But yet sometimes you give them enough leeway for them to make mistakes. Yeah, but that's how you support them. But it is not something where it is just going with the flow. No, the flow is kind of mutually agreed upon. Let's say, let's work towards having a goal of, for example, in this case of functional normalcy, then about getting a job, and let's support the person. And then the person works through all the necessary, and then it's okay, let's try. And they get a job. And after getting the job, you check back with them. How is it? And they may have good days, they have bad days, but at the same time, you also ask them, so do you think that you have succeeded in this? Are you happy with it? Are you not? Or when they face bad days, the most, path of least resistance for them is sometimes, I give up, I can't take it. And so that's when the mentor or the person journeys with them comes along and say, okay, well, have you tried in this manner? Why are you giving up? So that kind of supportive accountability holds them accountable. So sometimes the journey is about walking beside, sometimes walking ahead to show them, but many times it's also about following them, let them decide. So my last slide for just sharing this is that if, as I said, this is not a program, but it is my own relational journey, you have to consider the commitment that you want to be involved with a person's life who is facing or are facing issues. And you have to decide then whose agenda are you keeping and giving the person agency to decide what are the areas that they want to work on. And a lot of respect, a space given to them to fail, to make mistakes and all that, while at the same time giving that care. But yet, while that safety is provided in the relational thing, we as concerned adult can also provide a certain challenge for them to encounter. But when they fail, now it's almost like, don't worry, you learn to fall, pick yourself up, I'm here with you. Right? So as I said, it's not an easy journey, but it is one where you would have to also put for yourself boundaries and your own self-care. Okay, so for me, I'm very well aware but certain times where I myself am not feeling that good myself is to make sure that I speak to somebody, or I just do my daily routine of self-care to ensure that this is a safe thing for me as well. So I would say my journey with this particular mentee has taught me a lot. If you were thinking about mentoring just to help a younger person, a vulnerable person, actually sometimes it's the other way around as well. As I receive and I'm being taught by this mentee, the mentee's resilience, the mentee's oftentimes if I put myself in the mentee's shoes, I may not survive. So there is that strength-based resilience deep down inside. So a very short sharing, not evidence in that sense technical, but I'm just wanting also as a practitioner in this area, I'm also trying to invite people to who may want to explore what does it take to journey with a young person, perhaps with mental well-being challenges, and who want to work towards something. So they must be willing. I'm just wondering whether there are people interested, to kind of like, explore what it takes to take part in this. So I want to just put forth an open call here, and they might also pop into the link in case you can't get the QR code. Now, a community of practice is not so much a technical term, but it's just a gathering of a few people coming together to just explore and learn from one another what are the possibilities of helping people along this, and what does it take, right? So I'm very keen to find out whether there would be interest in this area, and very keen also to answer any of the questions that you may have regarding journeying with someone with mental well-being challenges. Okay, so I'll stop my sharing here, and I am having this privilege actually and honor to introduce to tell you that Glenn and I go back. Glenn, should I tell you which decade we go back to?
When we were youth at risk ourselves.
Yeah. So anyway, Glenn is multi-award winning, multi-hyphenated, and multi positions that he holds. But and I'll introduce Mr. Glenn Lim as the founding chairman of the Architects of Life. He's also the chairman for the Mentoring SG, Mentoring Alliance SG, vice president at Teen Challenge, and also chairman of Ex Offenders for Good, XOFG. And so it is my real pleasure indeed to then, Glenn, welcome you to the stage, and it's all yours now.
Thank you, John. And thank you everyone for your enthusiastic participation. I'm speaker number 3, and my topic would be on this: mentoring beyond lane A. At Architects of Life, the social impact agency that we run, we believe a lot in mentoring a person in parallel, if you like. So there's lane A, which is the typical surface lane or trajectory of youth at risk. But there's also lane B, which many mentors don't know about. And therefore, how we end up working with offending prone youth and youth at risk is always trying to fight fire, always crisis managing, with no end in sight. So these days, when we talk about the multiverse, right, or the metaverse, there seems to be parallel universes that we can actually conceptually apply in our strategy working with young people. Let me just tell you the genesis of this. This came about when I was mentoring ex-offenders myself. You know, in Architects of Life, we don't just work with youth at risk in the homes, juvenile institutions, but also ex-offenders. We go into prisons. We are strongly associated with MHA, Home Affairs. So mentoring, the keyword, and I want to emphasize what my co-presenters have already done. So if in case you didn't catch it, trust is so crucial. It's a currency that we use when we're working with particularly youth who have a dysfunctional background or broken past. And that's why when we journey along with a young person who is predisposed with all the risk behaviors, right? That currency is the make or break. We can have all the knowledge and skills and strategies, right? But if you don't have the relationship, we have no currency and we can't speak into their lives. So let me dive into what this mentoring beyond lane A/B. And I think the best way to do this is to do a side-by-side comparison, A/B comparison. So let me begin. Mentoring a youth at risk at lane A is like fixing problems that are current in his life. Whereas in lane B is starting to create future possibilities. Lane A is short-term solutions. Obviously, when you want to fix problems, you're only thinking short intervals, right? But lane B presupposes you can think far, have foresight, and develop long-term strategies. Lane A is mainly intervention in nature when you come into mentor, almost like a social worker. But lane B presupposes there's potential that you want to invest in. And investment simply means biggest bang for your buck. Which area do you want to focus in so that you can have some sort of a ROI, return on investment? Lane A is very passive in terms of the way the youth or the ex-offender receives help, right? He's just passive. It's like, oh, like that, law, right? This is me, law. And sometimes they have fatalistic thinking, a very defeatist victim attitude. And so he's just waiting for support or help. Whereas lane B type of mentoring encourages the mentee to be proactive in carving his future. Lane A is a lane A mentee is very impulsive in his thinking. So when we talk about neurobiology, cognitive functioning, is very limbic system. Limbic system is very emotion-based and survival instinct at best. So when you talk about the nervous system, you're talking about fight or flight. A lane A youth at risk on a daily basis, even because he has to handle drama, right? He's constantly thinking of reacting to his circumstances. Whereas lane B, he will start to be anticipative. And when you start to think ahead and use foresight competencies, foresight and critical faculties, you're actually using a part of your brain called the PFC, the prefrontal cortex, and you're starting to develop that part cognitively, with critical thinking skills. Lane A is focusing on urgent things, whereas lane B can start to focus on important things. Those of us who do goal setting, time management, you understand the concept of the Eisenhower matrix, right? And if you're constantly just attending to urgent things, they dart and flow, and you never be able to plan long term. You're always preoccupied with the urgent things that swarm at you day to day. Lane A is focused on relieving pain, whereas lane B doesn't mind the pain because it's a sacrifice that is worth it for long-term gain. Lane A is living day to day. I use the word crisis management because a lot of our youth at risk, they face drama. I mean, one day you solve one drama, the next day you're just waiting for him to say, oh, I'm out of money, I can't pay the bills, my phone lost, and something happened to my family, my parents. I have to go hospital, I have to go police station. It's crisis management and intervention. Whereas lane B is starting to think long-term and build the future. Lane A is, well, the outcome of lane A, if we're just solely living day to day, hand to mouth, the beneficiary, the mentee will miss a lot of opportunities in life. Whereas lane B, you start to utilize and fulfill your potential. I'll give you a very quick example. When we want to plan these days post-pandemic, I know the The revenge travel hasn't ended. You know, many people, including myself, I'm planning like where to go and travel middle of this year, end of this year. You know, a lane A person is just going to wait until the last minute, right? And then see, okay, I think I want to go to, say, Japan next month, and then start going online searching in a hurry, very hastily. And you will notice all the flight tickets are so expensive because it's just 1 month away. But if you really plan in the longer term, and you plan 6 months, even a year ahead, you're gonna find cheap tickets, cheap flights, right? And you're always getting a more favorable outcome, right? You won't miss opportunities. Lane A, the mentoring goal, of course, you still mentor, right? A youth at risk who is going through crisis, but the mentoring goal is stability. Whereas lane B is sustainability. What's the difference? Lane A is just getting the person stabilized, pay his bills, solve certain outstanding problems in the now, and that is good. But the problem with that is that the mindset of a lane A mentee is that he thinks, oh, no more problem, so no need to plan anything else, and just a sigh of relief, waiting for the next drama to happen in his life, right? So he's not thinking long term, and whatever he does, let's say he gets a job, right, a low paying job, and that's fine, entry level, but then he's thinking this is it, and when I ask some of these mentees, what do you have in mind for the long-term future for your career planning? This is just a job, and it's good for the cash flow, it's needed. But how long are you going to stay on this job? They're not thinking ahead, and therefore they don't invest in their own self-development, lifelong learning. Ask them to do WSQ skills future. They say, no, I'm not the study type. So they're very satisfied with the here and now, as long as there's no problem. Lane A, the role of a mentee is almost like a firefighter, fighting fires, putting out little crises here and there, and every now and then having a respite. And then say, at last, okay, and just waiting for it, because there's no other lanes he can jump on or create. Whereas lane B is an architect. He builds the future. It's not there yet. It's certainly not in front of you, but he plans, he designs, and ultimately, because of the vision for himself, he's able to work towards it and literally architect his life. And that's one of the reasons why we're called architects of life as well. So I just wanted to give a distinction between lane A, lane B as a comparative chart here. But that's not all. I think many of us are wondering, so okay, now I know the difference between lane A and lane B, where do I even start, and what station am I at? So I've taken the liberty to use some of these charts. This is almost like a funnel system. And let me help show you and unpack it to you one by one. I call the first 3 stages the starting stage, where you can see in terms of the roles, the mentoring objective of each stage. Stage 1 being compatibility, you're checking each other out. Stage 2, availability, where you avail yourself. And then stage 3, again, working towards the outcome of stability. Then the second role is the mentors, function, and the roles. So I call it the C's. Chemistry for the first stage. Of course, you will need to see, because trust is so important, right? Assess suitability. Usually start at interest level, and then aspirations, maybe even your work or vocation, and a youth at risk at a mentoring program. I'm talking about agency mentoring programs, right? Where we assess suitability and chemistry fitting. They sometimes build friendships much more easier to the mentor if they have similar interests and maybe even vocations. It gives a kind of a modeling to the young person. Second stage, of course, is availability, and now you're building that confidential relationship. Rapport, trust, safety, self-disclosure, and vulnerability on the part of the mentor, to me, is absolutely crucial, because it shows that you're authentic. It shows that you're not just this model, picture perfect. Your life also has some shortcomings, and maybe you face certain personal challenges, and you're okay about it. You become that model of what it means to be real, genuine, and also that you're human. Okay, I think that's very important. And then stage 3 is where you begin to move into what I call a counselor role. Now, when I say counselor, I don't mean a clinical therapeutic kind of relationship. Maybe something like what John has mentioned in terms of therapeutic mentoring. But all you need to do is just to hear him out, right? Hear her out, be present, be supportive, be encouraging. Sometimes they do need certain intervention, and that's where maybe your skills are important. You see, mentoring a mainstream youth versus mentoring a youth at risk, obviously you need some kind of intervention skills, regulation skills. Emotions are a big factor, because emotions can actually self-sabotage. Young people When you become impulsive and hasty and act on the emotions, a lot of things can go wrong, right? And so you are that stable journey companion of a counselor, meaning wearing a counselor hat, right? Now, you will notice that these 3 stations are in red because they belong to the lane A, the first lane. Remember, stability, and sometimes having to fight different battles all at once, complexity of different issues. But there will come a time where it will be stable. And that's where we start to move to lane B, the blue color segments. And in lane B, station number 4, that's where now you're moving as a mentoring objective to build competency, build ability, right? And therefore, your function now is starting to shift towards being a coach. Now, of course, if you have coaching skills, like even credentials, that will be good. But I feel as a mentor, you don't really need that because you are an older person who have lived through life. So you do have lived experience. And when I say coach, I don't mean just the vocational skills or technical skills. I mean life skills, soft skills, communication skills, learning how to work with people management, interpersonal, teamwork, things like that, right? But at this stage of stage 4, that's where long-term planning can take place because you start to help your client identify strengths, weaknesses as well, talents, and then you can start to develop them. The problem with most youth at risk is because they live in the here and now most of the time, a lot of their natural talents are untapped and underdeveloped. But you as a mentor coming into his life, having fulfilled the first 3 stages of trust, being present, supportive, now you can start to build competency as a coach. And now, of course, the last stage, I say last stage because I have 5 stages here. Obviously, your relationship mentoring can go on, right? And you can review and set new stages as well. But when we talk about sustainability, this is what we're talking about. So now at stage 4, he is building competency, ability, maybe even knowledge, going for training, going for WSQ courses, studies. And then you can start working with him on goals. It could be on actual projects. Some of our ex-offenders, we help them at this stage go into leadership. So project management, for example, because at XOFG, ex-offenders for good, we do have many projects, fundraising, whatever it is. We get them involved so they no longer become just a beneficiary, recipient, but they start being an asset. They move into giving. For example, many of them, that's just a simple little so-called personal project, right? We encourage them to share their testimonies, their life stories of their changes and transformation. They are afraid. They have never spoken in front of a crowd before. Public speaking was never in their agenda. So we give them the skills, we give them encouragement, and we empower them. Well, literally give them platforms like school talks. Don't talk about assembly school talks, but just small classroom, right? Classrooms. And these are real world, real projects, And maybe some of them, they're really looking at beyond their entry-level kind of jobs, and they're really looking at developing their careers. So we as an organization will help hook up to different partners, whether it's corporate or business partners of ours, personal friends of mine, for job placement, but not just finding another job to get by. We are looking at real career development, what the skills needed for the long time, for the long haul, not just for that 1 year, 2 years, and then move about, but what is needed to move beyond just a worker, maybe to supervisor level, team leader, manager, and who knows, one day director, and maybe even an entrepreneur. All this requires skills. All this requires confidence. And all this requires someone at the side of a trusted mentor all the way. And so we become cheerleaders. I always say, it's no longer us pouring to your life, but we at the sides cheering you on, clapping, jiao, you can do it. Yeah, fall, never mind, get up, do again. You're trained for this, you see. So we're positioning them, we're setting them up for success, for achievements. So there you have it, mentoring beyond lane A. I hope this is helpful. The first one was just to distinguish the differences between lane A and lane B, and how we need to constantly move to lane B. Otherwise, we're always fighting fire, crisis management, and just bringing them to a place of stability, where my view of them is to fulfill their potential. And that requires us to move beyond stability into sustainability. So I hope that was helpful for you. At this point in time, all 3 of us, we're here just to give little bite-sized, hopefully nuggets and insights to the kind of work that we've been doing with some of these practices. But I think what we are most anticipative right now is the Q&A portion. And at this point in time, I do want to call upon my co-presenters. All 3 of us are here. Thank you. And we do have time. Let's go for at least 15 minutes. So first one, 7 votes. How significant is neurological disorders like ADHD in driving youth offending? Based on Wilson's presentation, it seems that conditioning environment are the main factors to youth offending. So Wilson, maybe you'd like to take on this one first?
I think I've also added in the comment column, been looking at all the different questions, and I think I just give some bite-sized comments. I think, as mentioned earlier, I think predisposing environment, particularly from a very complex kind of family background, can be a key influence in a young person's life. But as the young person develop, right, there is also that neural kind of influence. You and I know that for the brain to be fully developed, it is up to 25 years old. So being young person, being a teenager, their brain is still developing. And sometimes because of that influence from friends or influence from the media, they will tend to be making decisions that is more impulsive. And they will also sometimes ignore the consequence before they embark on any risky behavior, very much because some of their friends might be doing and they are fine. So this idea of monkey see, monkey do. So yes, definitely there are many other factors as well. So, but due to the time factors, we are able to help us identify that because of ACEs, family history and family influences is one of the key factors. Of course, there are many other factors.
Yeah, can I just quickly just chime in very fast? Huh?
Yep.
Yeah, so we recognize that there are some predisposing factors that some people are affected by. So maybe if I can, I know it's a bad analogy, but if I were to borrow the analogy of a gun, right? So predisposing factors somehow shape the young person like a gun already, let's say, okay? Then the second factor that comes in is contributing factors. Contributing factors, for example, yes, a person may have this, may be affected by this, but they have never learned how to cope. They have never learned how to regulate. So coping skills or lack of it could be contributing, right? Or they mix around with wrong company, yeah? So they model of it, so contributing. But then there's one more. So contributing factors are like the bullet. So you shape like a gun, contributing is like a bullet, and then you got one more, which is a trigger. So trigger could be something that bad happened that day, or the outcome that they want to see didn't happen. So they get angry, they burst, right? And they don't know how to regulate and blah, blah, blah. So you find predisposing, shaped like a gun, contributing the bullets. And then when something triggers them, pom, it goes off. So then you see the offending behavior. So, I mean, if you see from that point of view, you are not labeling people, but then you are helping them to manage. Yeah.
Wow, what a wonderful analogy, John. Yeah, so thank you, guys. I'll go to the next question. When you say journey with someone, what are the elements inside? Is there a time frame? What are the stages of development? Any one of you?
Sure, I'll take it. Depends on whether it's a formal engagement or informal. So if formal, yes, the stages of journey, for example, in mentoring, there will be in 3 stages. One will be the opening, where you are, building relationship. Second one is the working, where you're working on certain goals. And the third one is the closing, where you actually terminate that relationship, which is formal. So in some cases, like in Wilson's case, in the MA case, then it's maybe 6 months to 12 months. So that's formal. Informal is there could be no end. So depending on how you want to take part in it. Yeah. So that's my contribution here.
Thanks. Wilson has given some comments.
I don't think we can address all the questions, so I just try to give some bite-sized comment. Usually, typically for journey with a young person, minimally we are talking about 6 months. So really involve availing our time and being there for them, and having to playing a very key role in crucial period of their lives, right? So that when they are in need, in need of advice, for example, we are there to listen. We are there to direct them to certain options and helping them to make certain key decisions. And even if we think that they are making wrong decisions, we can actually help challenge those decisions and help them think twice before they do certain things.
That's right. Yeah. So once again, thank you. This has got to do with the question about journeying with someone. Yeah. I would like to add in very quickly, mentoring is a long haul, long term. So yeah, minimum 6 months. The way we do it at the program level is 8 to 10 months. But you know, the way I do it is also in stages, right? Earlier on, I talked about 5 stages. So it really depends what stage as well. When we talk about the sustainability stage, lane B, for example, it could go as long as 2 years, 2 years. But there will always be a closing where we can evaluate, celebrate, and then start looking at opening again, recontracting another journey. I think that one helps us keep accountable to the goals that we set. Okay, let's talk about this one. How do we guide our children to control their own use of mobile devices? I mean, this is quite, China has done some things, right? John, any thoughts?
I was laughing at it because adults themselves don't know how to control. So
Yeah.
how do we model it? Yeah. So I think there are some comments put out here, and I believe Wilson put it, the very good comments over there about boundaries, about rule negotiation, and so on. Yeah. So maybe you take a look at that, and I think
Yeah.
because it's also age specific. Yeah, depending on what age and your relational quotient with them. Yeah.
Yeah, that's right. So we leave it as that because the comments are very helpful by both our presenters here. I'll just go quickly, otherwise we won't be able to cover. What are the criteria for adult mentor hires? Okay. Maybe I'll answer this, Ken, and then you all chime in. Yeah. What are the criteria? For me, very quickly, I follow the 4 C's. You need to be a confidant. That's number one, where you build trust, rapport, and keep things confidential. And then also a counselor and a coach and a cheerleader, all 4 rolled in one. I also call it the Swiss Army knife. Sometimes you use 1 or 2 for certain, issues or circumstances. But most of the time we play all 4, right? So these are kind of the informal criteria, I would like to say.
Yeah, can I add in another C for you? Yeah, capability. So I think in the course of the journey, mentors, if they are volunteering, they should be guided by a supervisor or someone who guides them along in picking up some skills at the same time. Yeah, so I think it's also skills focused.
Yeah. And mentors need to be trained, continual
Yes.
upgrading,
Yes.
etc. Wilson, what if my 15-year-old boy has none of the ACEs you mentioned, but still displays rebellious attitude, at-risk behaviors? Neurodivergence is another important factor. Yeah. And negative peer influence can have an important impact on teenage rebellions. Yeah. Yeah. So not necessarily ACEs are a determinant. They do, enhance or exacerbate the the predisposition for risky behavior. But there can be many factors. Even mental health, stress, the way they deal with stress, for example, or growing up phase, right? It's a state and a phase of sometimes disorientation and confusion even. So yeah, not necessarily just ACEs, right? Due to ACEs. It's best to go get a professional opinion on these things from a counselor or maybe even a psychologist, depending. Yeah. Okay, the definition of your mentoring journey is one where the youth is help seeking. But many times youths themselves do not think they need mentoring. Any tips to overcome resistance from them?
Yeah, I mean, for mentoring, it takes both the mentor and the mentee to be open in this relationship. Then there will be that learning that will take place. But of course, if the young person is rebellious and is resistant towards help, I don't think mentoring will be a good start. I would think the important part would be the first stage of building rapport, understanding what some of the resistance, why is he resistant towards help? Why is he resistant towards another person coming alongside? So building that rapport, having that connection at the very earlier stage will be important before even moving to the mentoring journey, right?
Yeah.
So I would say it's like a pre-mentoring kind of a rapport building outreach, being there and being present for them, being patient to understand what are some of the concerns. Even the young person may not be very open to talk to you, but being there to be just being present sometimes can be helpful to peel off certain resistance that they have. Over time, hopefully, there will be that willingness to open up to you because you have shown to be a consistent, caring adult in his or her life.
That's right. Yeah,
Can I just,
absolutely. Yeah, John, please.
Can I just chime in? And that's to be very clear in the work that we do with youth development and youth engagement. Mentoring is not the cure-all. Mentoring is not the panacea. Mentoring is not the silver bullet, right? Mentoring is important, but it doesn't cure all ills. So if a youth is still resistant, then they are not ready for mentoring. However, having said that, youth themselves are humans. They are socially constructed, socially whatever, right? So mentoring coming from that perspective, then the youth would lean to someone who is caring, concerned, and someone that they can trust, they can emulate. At the right time, the mentoring will take off. If not, never push mentoring onto a mentee who doesn't want it. Yeah.
Yeah, well said. I do want to just add in that in the developmental stage of adolescent or youth, relationship is everything. And therefore, young people don't care what you know until they know what you care, correct? So relationship really is that currency. Yeah. Let's move on. For mentoring youth at risk, would one-on-one or group mentoring be more effective, or maybe a hybrid?
There is no one correct answer, right? So it all depends. In my own experiences, sometimes we break down groups. They kind of like, just flock together. So birds of the feather flock together, right? So, and they tend to, and for those groups, we do group mentoring. So we have 2 mentors, maybe to a group of mentees who share similar characteristics or similar goals that they want. Yeah, so in that sense, it all depends. There's no hard and fast rule. Whatever works should work. If it doesn't, it doesn't. We're not saying that you have to be one-on-one or group. Yeah, from my experience.
Yeah. I think Wilson has a comment here as well. Hybrid, both group mentoring, 1 or 2 to 3, and individual mentoring, correct? And YGOS in the MA programs consists of 22 sessions over 6 to 8 months. Yeah, usually 12 individuals, 10 group sessions. This is exactly what we do at Architects of Life as well. We believe in the concept of clustering and declustering. So it keeps things nimble, and the dynamics is the interplay of those dynamics help a young person understand that, yes, while he has personal one-on-one issues that can be addressed in that one-on-one, confidentiality, but still he's a person in a social context, in a tribe even. And all those social emotional skills can only be seen when he works in a team, right? Or in a group. So we do have those hybrid moments as well. So the quick short answer is that yes, hybrid type of mentoring is useful. Yeah, not just one-on-one or group. Next question, the recent bullying at Montfort. And I wonder, beyond punishing and counseling the bullies, are there things we can do to support these youths? John is very a veteran in schoolwork, particularly youth at risk in the schools. John, would you like to answer this first?
There was a comment, I think, Wilson, you put in also, right?
Yes,
about restorative practices. Yeah.
RP,
So, but I wouldn't comment on this case because I don't know enough information about this, but just in general, right? Yes. So when we look at bullying, it has to be tackled at all levels. So it's a system, it's systemic, it's systematic, it's individuals, it's the perpetrators. Evidence also show that sometimes the people who carry out bullying were themselves bullied, right? So et cetera, the bystanders, the parents, the teachers, the system, whole lot of things to be looked at. Yeah. But I think Wilson's putting down the point is very powerful because that is the idea of restoration. So maybe over to you, Wilson.
Yeah, they may not be very good to comment on the recent incident, but I suppose punishment is not the only way. RP seeks to restore relationship and also to build relationship. I think if we can have that opportunity to bring both the perpetrator and also the victim together and sit down to debrief, to talk about what has happened and what are some learning points, it will really be helpful for that reconciliation. Yeah. So punishment may not be the only way to do it, but I would think to put them together in the restorative practice kind of a circle time will definitely need more resources and more time to prepare both the perpetrator and the victim to be ready emotionally to be able to come together. So that will take a bit of time.
Yeah, thank you. For those of you interested to find out more about RP or restorative justice, RJ, they are readily available online, Google, and then you understand the concept as you read how it helps restore, maybe even reconcile, but ultimately building awareness of the impact of especially the police, right? How do you deal with blatant lies? A bit difficult, no context, but let's see the comment here. Confront gently, correct firmly, be patient, calm when dealing with them in conversation. Yeah. Wilson, is this you?
I mean, there's no context to
There's no
what
context.
and whether it's a teacher relationship with the student or it's a parent relationship with the child. But I think in generally is the young person need to be confronted. If it's a habitual kind of a blatant lies, it shouldn't be kept and swept under the carpet. But finding the right opportunity to do so is important. And being very patient and calm in those situations will also be important because you don't want to take things too personally and too emotionally. And that's where some of the words that you say or you use can actually trigger a series of reaction that sometimes may not be very helpful in confronting or in correcting such behavior.
That's right.
Yeah,
I would say also the youth is also watching how we deal with this as adults, right? And they are watching and seeing how we respond to it, whether it's whether he's safe enough to even tell the truth. Okay, let's go to this, but down to like.
Can I chime in, Glenn? Don't mind?
Yes, please.
Yeah, so I'm just looking that, I mean, it's just not about blatant lies or whatever. Any form of misbehavior, if you look from the philosophical point of view, right? So, I mean, the foundation of how we want to respond, any form of misbehavior is actually purposeful. And the purpose is something that the young person wants. All right. So in other theories, it states that everyone is trying to find a place on this earth. So somebody may feel that by lying, they can get there. So it could be a form of wanting affirmation, wanting power, wanting revenge, wanting to hurt. We just need to get to the source of what drives their behavior. And sometimes the young person themselves may not know. And in order to get to the source is how do we listen so that they will talk, and then switch, how do we talk so that they will listen? It's about helping them get to the deeper spheres and outcomes. So sometimes youth just react because they don't know any better. But if we can get into their psyche, into their soul, and understand them, then they will probably think actually they do not need to lie, because by lying they hope to get something or whatever. And that's why we get to the source, and that requires a lot of that carefrontation. That means you confront in a caring manner. Yeah,
that's right. Yeah, it's a boy that is having depression and keeps using phone gaming at home suitable to have a mentor. Let's check out the comments. Do reach out to some of the social service agencies. They have intervention programs for youth with these issues. Any quick comments? Having depression, keep using phone gaming, suitable for mentoring.
I mean, the fact that the young person is having depression will definitely be needing more intensive kind of a support. Having another mentor to journey as a support would be helpful, but it shouldn't be just having a mentor without that professional intervention or support to help the young person deal with that mental health concerns.
Yeah, I think having a mentor is a protective factor, but possibly not the answer. Because you got two key issues, right? Depression, which is mental health issue, and also cyber wellness as well. Selective mutism in youth. What is the key factor to begin helping the youth to overcome this? Well, seeking professional help, yes, of course. Especially if medication is needed. Having consistent adults that can be there to support the youth. Using a journal or other modes of sharing their thoughts, because they can't articulate. So I personally like them to draw, meaning art therapy, but that's very therapeutic in nature. And instead of focusing on talking, if they are much younger, play therapy is great, using toys plus the scene, but it's professional services already. Yeah. Okay. Maybe one more, huh? What are the options of parents when all other interventions have failed, especially when should we turn to, what's this?
Family guidance.
Family guidance officer. Yeah. Anyone?
Family guidance order. Yeah. I think I definitely comment to say that there are support and that you can get from the SSEs. They have various programs, various intervention, various social service professionals who can journey with the parents and also seek to reach out to the young person. I would personally think that FGO would be the last option. It shouldn't be taken as the only option or the first option when we encounter a very challenging, rebellious kind of a teenager. Right?
So I just want to speak in general to all the parents here, or you may know, your friends or family members who are also struggling with having children that are not so compliant, right? Just know before you do anything, do reach out. The social service sector, the helping sector has become more sophisticated, has become more resourceful all these years. Just do not do it on your own. Don't think that you're all alone. Reach out to agencies. There will be a way out. Yeah.
Yes.
That's my assurance.
Yeah. And I do want to close with something inspiring. When we talk about the animal kingdom, elephants in particular, when they're young, the young calves start to go into teenagehood, adolescenthood, their hormones start kicking in. We call it the Musth cycles. And they become so hormone rage that they go around being violent, kicking at trees, tearing down things, and fighting against other animals as well, and causing harm and danger. So what happens in this the brood is that when the Musth cycles in young calves begin to stabilize much quicker when adult elephants, particularly male adult elephants, are introduced into their lives. The adult elephants teach the calves how to utilize their energy and put their developing strength to good use. They literally take, like, mentor one-on-one, bring them away to a far place, away from the herd, for a few weeks or months. And then when they return, the calves, the teenagers, have actually stabilized and regulated their hormones and emotion, if you will. And I think this is such a powerful picture for us as adults, whether you're parents, caregiver, volunteer, and mentor to young people, and particularly youth at risk. We don't know what's happening in their lives, and we should not judge. But if we genuinely care and are, concerned for their well-being, come alongside them, support them, and journey with them. Who knows, as they look up to you as a form of a model vicariously, they will know how to stabilize themselves as well. But it's going to take some period of time. It's not just a 3-day camp that will fix things, okay? Because relationship is at the center of this.
Okay, thank you very much.
Thank you, guys. Have a pleasant evening and a wonderful weekend.